This is fentanyl, and it only takes this much of it to kill you. But why is that? What makes this powdered substance so harmful and dangerous to the human body and its mind? And why is it so addictive? Why is it considered to be one of the most harmful drugs you can ever put in your body? Before we continue this video, this is strictly for educational purposes, and I am not glorifying the use of fentanyl or telling anyone to try it. Now, to answer all these questions, we first have to answer, what is fentanyl? Fentanyl is a synthetic opioid, which basically just means instead of it being grown on a farm like heroin would be, it's synthesized in a lab by chemists and scientists. It was actually developed for a good reason originally, reasons like helping sick patients in the hospital deal with terminal diseases such as cancer or any other life-threatening diseases. Even surgeons would utilize fentanyl because, similar to morphine or anesthesia, it would numb the patient's pain while they were going through the procedure. This is because fentanyl is actually 10 to 15 times stronger than morphine, and because of this, doctors had to be very careful when they gave out these doses. But this is not the kind of fentanyl that we're going to be talking about today. This is the kind of fentanyl that we're going to be talking about today in this video. You know, the illegal, harmful, unregulated kind of fentanyl that's usually synthesized in underground labs by criminals. And to make things even worse, fentanyl is oftentimes cut into other drugs such as Percocets or Xanax and any other type of pills, maybe even cocaine. So half of the time, the user doesn't even know that they are actually taking fentanyl. And this is a giant problem simply because of how fatal fentanyl can actually be in such small doses. And this is because of what happens when you actually take fentanyl and what it does to your brain. Fentanyl latches onto something in your brain called your opioid receptors and almost manipulates your brain in a way by giving you tons of feelings such as dopamine, stress relief, and even euphoria. But behind the scenes, it's really just killing your brain cells. This is why once you sober up from the fentanyl, you immediately crave so much more because your brain starts to become dependent on it. And this is typically how the cycle starts. After you sober up from that first time taking fentanyl, it becomes very, very difficult to actually quit. And if you do try to combat those urges and those cravings to do it again, be prepared to deal with a plethora of withdrawals, such as depression for starters. Couple that with some severe social anxiety, tons of sickness such as vomiting and nausea, and even hair loss. And it doesn't stop there because you're also going to notice that you begin to rapidly age. You're going to see that your teeth start rotting. And in some cases, and most cases, you'll even end up sacrificing your relationships because of your fentanyl addiction. And this all continues until your brain almost shuts down in a way. And shortly after your brain shuts down, so does your breathing. And this is the cycle that a large majority of fentanyl users actually end up going through because of how dangerous and addictive the drug is. They can't seem to quit because of how strong it is, and they just continuously want more and more and more until their life has virtually been thrown in a dumpster fire and it's too late. And in more recent times, things have gotten even worse because fentanyl has actually become a more popular drug of choice for drug dealers and criminals because of how cheap it is and how profitable it is. These people only want to make money. They are not actually sitting there and thinking about the long-term consequences and effects that their actions have because they're only thinking about the quick profits and the luxurious lifestyle that selling this drug could provide for them. And because of this way of thinking, over 72,000 overdose deaths were recorded in the year of 2022, along with another 180,000 fentanyl-related visits to emergency care centers. And in the following year, over 500,000 cases of misused fentanyl occurred because people were being laced and the drugs they were taking were actually cut with fentanyl. And because of how harmful this drug is to our society, the government and law enforcement has been working extra hard to get it off the streets with constant drug busts and seizures where they will take bricks on top of bricks of fentanyl from these people selling it, as well as giving them significantly harsher prison sentences than other drug dealers because of how dangerous it is. The government has not only done all that, but they've also opened up several rehabilitation facilities to help people going through fentanyl addiction. There's also things like Narcan or naloxone that regular everyday people can have in order to save somebody from a fentanyl overdose, as this essentially acts as a temporary lifesaver. What it does is it latches onto the same opioid receptors that fentanyl does when it gets inside of your head, and it essentially defends your brain from it, knocking it out in a way and blocking it from actually getting to your brain. This is why it's considered a temporary lifesaver, because it's almost like it lets your brain recover for a short amount of time. Think of it like a med potion or a med kit in a video game. It's very good. And this time that fentanyl gets blocked by the Narcan is typically enough time to save somebody from overdosing, getting them into an ambulance, bringing them to the ER so they can make a full recovery from their overdose. And there's not only Narcan, but even fentanyl testing strips to make sure that whatever drugs that you are doing are not laced with fentanyl. But the moral of the story is that being prepared can literally save somebody's life, as this drug is very dangerous. Now, if you enjoyed watching this video, be sure to absolutely decimate and violate the like button so I can pay my bills, and thank you guys for watching.